Turtle. Let's do the handover from Mr. Cat to Dr. Bear. Please use the A to G framework for your clinical assessment.
Yes, Bunny. Okay. I is for introduction. Hello, Dr. Bear. I am Turtle, looking after Mr. Cat in bed 4.
Go on.
S is for situation. He was admitted with a respiratory infection, but he now has an acute exacerbation of asthma with severe shortness of breath.
Okay, what's the background?
Right. B is for background. History of chronic asthma.
Yeah.
He's been non-compliant with his preventer inhaler recently.
All right, let's hear the assessment.
A is for assessment, going from A to G. So A, airway. Airway is patent, but he is speaking in short phrases. B is for breathing. Respiratory rate is 26. O2 saturation is 91% on room air. And I hear loud expiratory wheezing.
Got it. Circulation.
C, circulation. Heart rate is 110, which is tachycardia. Blood pressure is 135 over 85. Capillary refill time, or CRT, is less than 2 seconds. D, disability. GCS is 15. He is alert, but highly anxious. E, exposure. Temperature is 36.8 degrees Celsius. No rashes or swelling.
Right.
F, fluids. Oral intake is poor due to dyspnea. And G, glucose. Blood sugar level is 5.5.
Thank you. And your recommendation?
R is for recommendation. I recommend starting a salbutamol nebulizer and providing supplemental oxygen to maintain saturations above 94%.
Thank you, Turtle. I'll order the nebulizer now.
So let's zoom in on the most crucial and, frankly, the meatiest part of that report. The A for assessment.
Ah, yes. The core of the clinical picture.
Right. Because in the skit, Turtle used the A to G framework for this.
The assessment section is where you present exactly what is happening right now. An A to G is a systematic head-to-toe way to assess a sick patient.
Head to toe, got it.
But the absolute most important thing for learners to understand is the causality behind it. It is strictly prioritized by what will kill the patient first.
Okay, to use another analogy, I look at the A to G framework kind of like troubleshooting a house fire.
Okay, I like where this is going.
Right. Like if you arrive at a blazing house, you have to extinguish the flames in the front doorway before you bother walking into the kitchen to check if the sink is leaking.
That is the perfect way to look at it. You fix the immediate life threat before moving deeper.
So A stands for airway. This is your doorway. Priority number 1.
Priority 1, you are checking, is the airway patent.
Patent. That's one of those clinical words.
Yes, and for our medical English students, in medicine, patent simply means open and unobstructed.
And why is this first?
Because if the airway isn't patent, air can't get to the lungs, and the brain dies in minutes without oxygen.
Makes sense. In our scenario, Turtle noted the airway was patent, meaning nothing was blocking the throat, but the patient was only speaking in short phrases.
Which tells you there's a problem further down the line.
Right, he has the path open, but he's struggling to pull enough air to finish a sentence.
And that logical progression brings us right to B for breathing.
Because this isn't about the tube being open anymore, it's about how the lungs themselves are actually functioning.
Exactly. Turtle noted a respiratory rate of 26.
And a normal adult breathes, maybe 12 to 20 times a minute?
Somewhere in there, yes. So 26 means his lungs are really working overtime.
And critically, Turtle stated the patient's oxygen saturation was 91%, quote, on room air.
Yes, on room air.
I actually want to pause on that phrase. I used to wonder why a nurse would bother saying that. Like, if the doctor is standing right there, they can plainly see the patient isn't wearing an oxygen mask. Why state the obvious?
It's a great question. Because handovers frequently happen over the phone to a doctor who is on another floor.
Oh, right. They can't see the patient.
Exactly. So room air is a vital medical phrase that establishes a baseline. It means the patient is breathing naturally without supplemental oxygen.
Which is about, 21% oxygen in the room?
Right. So an oxygen saturation of 91% on room air is concerning, yes.
Nice.
But an oxygen saturation of 91% while a patient is already blasting maximum 100% oxygen through a mask.
Oh, wow. That's bad.
Very bad. That means their lungs are completely failing and they need life support immediately. Context changes the entire medical intervention.
That makes total sense. Context dictates the severity. Okay, sticking with breathing, Turtle also mentioned a loud expiratory wheeze.
Yes, an important clinical sign.
Let's talk about the mechanics of a wheeze. It's that high-pitched whistling sound, right?
Yes. So think of the airways inside the lungs like a network of flexible pipes.
Okay.
In an asthma exacerbation, those pipes become inflamed and they squeeze incredibly tight.
And when you force air through a narrowed pipe,
It whistles, exactly. But notice the specific word Turtle used, expiratory.
emphasizing the X.
The prefix X means this whistle happens specifically when the patient is breathing out, exhaling.
So that is a massive diagnostic clue.
Huge. It means the lungs are trapping the air inside.
So if the lungs are struggling to pull in and push out oxygen, how does the rest of the body react to that shortage?
Well, that logical jump takes us right into C.
C for circulation.
Precisely. The systems are all connected. If your blood isn't getting enough oxygen from the lungs, your organs still demand it.
They don't care that the lungs are failing, they just want oxygen.
Right. So the body compensates. It forces the heart to pump the limited oxygen. It does have much faster.
And that's why Turtle reported a heart rate of 110, noting it as tachycardia.
Yes. Tachycardia simply means a fast heart rate. The heart is basically racing to make up for the failing lungs.
It's a total chain reaction. And under circulation, Turtle also checked the CRT capillary refill time.
A classic assessment.
Turtle said it was less than 2 seconds. I find the mechanism behind this one fascinating.
It really is a brilliant, simple test. You just press down on the patient's fingernail until the nail bed turns white.
You literally squish the blood out of it.
Yep. You let go and count how many seconds it takes for the pink color to return.
It's basically checking the plumbing. Like if you think of the circulatory system as a town's water supply.
I love these analogies today.
Thanks. The heart is the main pump.
Yeah,
And your fingertips are the furthest houses on the pipeline.
exactly.
So if the pump is failing or there isn't enough fluid in the pipes, those furthest houses lose water pressure first.
Spot on. If it takes longer than 2 seconds for the blood to return to the finger, you know your patient's circulation is in major trouble.
That is such a cool visualization. Okay, so airway, breathing, circulation, the ABCs are your immediate life threat checks.
Right. And once you know the patient isn't going to die in the next, say, 3 minutes, you move down the framework.
D is for disability, which is a neurological check.
Hey. Turtle used the GCS Glasgow Coma scale of 15, meaning fully alert, but noted the patient looked anxious.
Why anxious?
Because a brain starved of oxygen naturally triggers a massive panic response.
That makes sense. Then E is for exposure, just looking at the whole body. Temperature was normal, no rashes.
Which is important because ruling out rashes rules out things like a severe allergic reaction causing the breathing issues.
Good point. F is fluids. Turtle noted poor oral intake because, quite frankly, if you are fighting for your life to breathe, you aren't going to pause to drink a glass of water.
You are definitely not.
And finally, G for glucose. Blood sugar was 5.5. Why check blood sugar in an asthma attack?
Because extreme low blood sugar can actually mimic other severe medical emergencies. It can alter consciousness and breathing.
So it's a quick check to rule out a compounding problem.
Exactly.
The elegance of A to G is that it just forces you to be thorough, but in the exact right order.
It really does.
But, knowing all this underlying physiology is only part of the battle. Actually delivering it with authority, especially for an English learner or a first-year student, is where the real challenge lies.
Oh, absolutely. The words you use carry a lot of professional weight.
Let's do some speaking tips here. The medical terminology acts as this precise shorthand. Let's look at the phrase Turtle used to describe why Mr. Cat was there.
Turtle said he was having an acute exacerbation.
Right. For our English learners, acute exacerbation. If a junior nurse just says he's having a bad asthma attack, it sounds kind of colloquial, right?
It does. But saying acute exacerbation makes the senior doctor stop and really listen.
Why is that?
Because it conveys precise clinical data. In a medical context, acute means a sharp, sudden onset.
Like it's happening right now.
Right, as opposed to a chronic condition, which is long-term. An exacerbation means a severe worsening or flare-up.
So putting them together, acute exacerbation tells the doctor that a pre-existing condition has suddenly and dangerously spiraled out of control.
Exactly. It commands clinical respect.
We also saw Turtle use the phrase admitted with, like he was admitted with a respiratory infection.
Yes, you specifically noted this is the standard professional way to start a handover.
It just sounds so clean.
It immediately gives the doctor the historical context of the hospital stay before you hit them with the current emergency. It frames the whole narrative.
Now, let's look at the very end of the ISBAR report, the R recommendation.
A tough one for beginners.
Very tough. Turtle said, I recommend starting a salbutamol nebulizer. You speak clinician with the doctors and you speak human with the patients. Why is that distinction so critical?
Because medical jargon breeds fear. I mean, imagine a patient is already suffocating and a nurse walks in and says, Sir, you are experiencing severe dyspnoea and tachycardia due to an acute exacerbation, and you've been non-compliant.
Oh my gosh, the patient is going to completely panic.
Panic, and they're going to feel judged. They feel alienated from their own care.
Let's do some live translation from the source material to practice this. We just mentioned dyspnoea. That's the clinician word.
The human translation is simply difficulty breathing or shortness of breath.
Perfect. What about tachycardia?
Tachycardia is for the doctor. At the bedside, you look at the patient and say gently, your heart is beating quite fast right now.
The source material also brings up sputum versus phlegm, which I find really interesting.
They mean the exact same thing.
But sputum sounds like a lab sample, whereas phlegm, or mucus, is what a patient actually understands they are coughing up.
Exactly. You have to use the word they use at home.
Now, here's a phrase that I think requires a lot of empathy to bridge. Non-compliant. Turtle noted the patient was non-compliant with his inhaler.
Oof. That is a dangerous one if misused at the bedside.
Because comply means to follow rules. So non-compliant means they aren't taking their medication as prescribed.
Right. But if you walk into a room and tell a patient you are non-compliant, it sounds like you're scolding a child.
Yeah, bad patients.
Exactly. Language bridging here is about empathy. You might say, I see you haven't been following the medical plan. Or better yet, ask a question.
Like what?
Like, have you been having trouble taking your inhaler at home?
Oh, I like that. That shifts the dynamic from a lecture to a partnership.
It really does. And we already covered exacerbation. At the bedside, you just call it a flare-up.
Speaking both languages smoothly is really the hallmark of an exceptional nurse.
It takes practice, but it's what separates good clinicians from great ones.
Okay, you're the nurse. A patient arrives in the ER. He says his chest feels super tight, his heart is racing out of his chest, and he admits he stopped taking his heart pills a week ago.
Okay.
You notice he's gasping and taking way more breaths per minute than normal. But his throat isn't blocked. You press on his fingernail, and it takes 4 seconds for the blood to come back. Go.
All right. Translating to clinical. The patient is experiencing an acute exacerbation.
Yep.
He is non-compliant with his medication.
Good. Assessing A to G.
His airway is patent, but he has severe dyspnoea.
Right.
Shown by an elevated respiratory rate. He has tachycardia and poor circulation, evidenced by delayed CRT.